Hi, I'm Sarah, and I'm a registered clinical counselor. A lot of what people find helpful is being with someone who is genuinely non-judgmental and believes the best in you. You've made it this far in life. You are obviously an incredibly strong, intelligent person to get where you are. It's my job then to figure out where all of those strengths are. And then what are you struggling with? What do you need from me based on everything that I have heard so far? As a therapist, my goal for you is to be able to provide that space to be comfortable and feel safe in that full expression of your pain. And if it needs to fill the room or if we need to fill the universe, as long as we really try to get you to the fullest, most authentic expression of what it is that you are feeling. In my practice, I focus a lot on grief and loss. We're often told to cheer up and look to another day and things will get brighter. But I really think it's okay to honor your pain and honor your grief and sit in what you lost and give it the space and time that it needs. And when we're experiencing that loss and pain and grief, it's often related to death. I've noticed that society isn't even great giving people the amount of appropriate space that they personally need as a human being in order to reconcile this massive thing that has just happened. But I've also noticed that it doesn't have to be a death-related loss for grief to be present in the room. Maybe you lost a job that you loved. Maybe you got hurt and you found out you couldn't do something that you loved anymore. You deserve to have yourself and other people around you be with you and not just try to cheer you up. And so a lot of the work that I do is to be with people when they've experienced that and to really show them a way and work with you to figure out what is it that you need in this moment of loss. Before we start moving and going forward, what do you need to get through the day? What do you need to get through the month, through the week? And then when you're ready, and only when you are ready, do we start talking about the future. But we don't rush that conversation either. I'm happy to meet you wherever you are at. If you want to spend some time getting to know each other and not diving into the deepest, scariest things right away, I totally understand that. Having a relationship that's already built and that exists with your therapist for a lot of people is really, really necessary to build some trust so that you feel safe enough to share the parts that really hurt. I really take the time to get to know you as a client. I really want to know what your struggles are, where you're at, where your strengths are. I'm not going to push you into a place that makes you uncomfortable. I'm going to let you lead the way. You are ultimately always driving the car. I want you to go at a pace that feels comfortable for you, feels safe for you. I know that it's not an easy first step to make when you're meeting a new person. And I think that when you get that fit right, therapy is like magic.